In this video, we'll discuss about acute inflammation. Four type of microbes: bacteria, fungus, virus, and protozoa enter human body. After entry, they causes ill effect. They causes diseases. So body have defense mechanism. What is how to define infection? Invasion by microbes, harmful microbes. Invasion by harmful microbes. It may be bacteria or fungus or virus or protozoa into the body, and their resultant ill effect caused by microbes, ill effect by toxin or microbial toxin. So how to define? Inversion by harmful microbes that result ill effect by toxin, ill effect caused by microbes. What is inflammation? How body respond it, and prevent it is known as inflammation. So what is inflammation? It is a productive response by the body to variety of etiological agent. What are the etiological agent? Infectious or non-infectious agent. It is a body defense mechanism of that body. It is a body defense mechanism in order to eliminate or limit the spread of injurious agent, followed by removal of that necrosed cells and repair of damaged tissue. WBC or leukocytes are the major infection fighting cells. WBC or leukocytes are the major infection fighting cells. There are two types of inflammation. One is acute inflammation, second one is chronic inflammation. In this acute inflammation, rapid onset. This one, first one is rapid onset. Example, take example of tonsillitis. Tonsillitis caused by bacterium Streptococcus pyogenes. As soon as bacteria enter human body, within or symptoms appear. This one is immediate symptoms, immediate response. Whether taking treatment or not, it survey 7 days. So here onset, rapid onset, then short duration, then that important hallmark. Important hallmark feature is edema, then main cell here neutrophils. In the case of chronic inflammation, example tuberculosis caused by Mycobacterium tuberculosis, but TB organism enter, it takes month or years. Then patient having symptoms, it may be 6 months or 1 year. So here duration is long, onset late, then longer duration, it shows 6 month or 9 month like that. Then granuloma, here granuloma formation, then macrophages and lymphocytes. Then acute inflammation having 5 cardinal signs. It having 5 cardinal signs. It occur any part of that body. Okay, any part of body of inflammation. 5 cardinal sign. First one is rubor, calor, tumor. Rubor, calor, tumor, and dollar. So these are the Latin terms. Latin terms. Rubor means English meaning redness. Calor, increasing local temperature. Tumor, swelling. Then this dollar, pain. These four, first these four are Celsius. First 4 are Celsius. Fifth one is that function levia, that means the loss of function. Okay, this one is So first, 5 cardinal sign: rhubarb, redness; calar, increasing local temperature; tumor, swelling; dolor, pain. These 4 are Celsius. Next one is function labia, that means loss of functions. This one is the temporary. All these things occur all part of that body, but here we are using Latin terms only, we want to write. For example, tonsillitis. This one, tonsillitis, that tonsil part surrounded tissue more redness, so rubor. Then that particular organ temperature increasing, calar. Then swelling will happen, tumor. Then pain we have, dolor. Then temporary loss of function, function labia. All the 5 presented. Okay, so all the 5 marks presented in acute inflammation. So all the 5 things: increasing temperature, pain, temporary function loss, we want to write Latin terms. And now we want to discuss acute inflammation. 2 type of inflammation, acute and chronic. First we want to discuss acute inflammation. It is totally having 11 event, 5 vascular event, 6 cellular event. So totally 11 event is presented. What are the 5 vascular event? Transient vasoconstriction of arterioles, then persistent progressive vasodilation, then elevate the local hydrostatic pressure, then increased vascular permeability, then slowing or stasis. We want to look at one by one in detail first. So totally 11 event. This one is the human skin. Then any injurious agent, it may be chemical or microorganism. So here bacterial toxin, this one is the bacterium. Okay, so this one is the bacterium, this one is the human skin, it enter inside. So this one is the blood vessels. Blood vessels having endothelial cells. Inside blood vessels, RBC, WBC, platelet, all the things is presented. Here we are drawing the WBC. So bacteria will come inside, means it causes sepsis. What body will do? It take WBC outside. It fight with the bacteria, ultimately phagocytosis. All the steps occur. Okay, here totally we know 11 steps, 5 vascular event, 6 cellular event. When WBC will come outside, outside blood vessels, the wall of the blood vessels have make some holes. After that it make fight. That was the summary. Event, transient vasoconstriction of arterioles. As soon as bacteria entry inside skin, the blood vessels just near it, the portion of that blood vessel causes vasoconstriction. So this one is few seconds or few minutes. This transient vasoconstriction, blood is less here, that is known as blanching. So that process, this one here less blood, so it have that name blanching. So it is transient, not permanent, few seconds only. In between skin and blood vessels, blanching. Because of blanching, very few blood, very less blood. If you look at that above, here you look at that above the skin, whitish or yellowish because of this blanching. Here whitish or yellowish because of blanching. It is local, only particular area, not all blood vessels. So this blanching, this one is the immediate reaction after injury, immediate reaction. This one mild injury means 3 to 5 seconds. Severe injury means 5 minutes. Second one is persistent. So second condition is the persistent progressive vasodilation process. Here vasodilation process. After 3 to 5 seconds, there is vasodilation. This is permanent. If you see above the skin region, it become red. Okay, here it become red, that particular area become red because more blood as com- as comparing to surrounding area. Okay, as comparing to surrounding area, this place warmer. If you touch that place more warmer, we will touch that particular place more warmer. So in this fluid only comes out. So third one is, so here what are the condition will occur? Redness and warmer, rubor and color at the site of acute inflammation. Third condition is elevate the local hydrostatic pressure. What will happen in this one? Fluid come out. So here in this one fluid only comes out. Here because of that reason edema will occur. Here not protein will come out, only fluid will come out. This type of edema is transudate. So this type of edema only fluid only come out, so it have that name transudate edema, increasing hydrostatic pressure. So, according to Starling hypothesis, blood vessels always two type of pressures. One is hydrostatic pressure. Okay, another one is osmotic pressure. Hydrostatic pressure due to water, osmotic pressure which is due to protein. Okay, protein, this one is the inward. Hydrostatic, this one is the outward. Both are equivalent and opposite. Whatever here molecules going outside and return to inside. No fluid means no edema. Fluid will come out and get accumulated here. So here fluid will get accumulated. That infected area fluid get accumulated. So it causes edema. More blood. So here more blood. More blood means more water, outward more and inward is less. So here increasing hydrostatic pressure. So here water more, so here edema, fluid only releasing, so transudate. Swelling at that local site of acute inflammation, so tumor. From fluid come from outside, so edema occur because of hydrostatic pressure increased. So third steps, elevate local hydrostatic pressure, only fluid only will come out, there transudates only come out. So fourth process is increased vascular permeability. This is the hallmark steps of acute inflammation. So increased vascular permeability is the hallmark of acute inflammation. This one leads to escape of protein. Previous method only fluid, only water, hydrostatic pressure only leak out. Here protein rich fluid, that reason it will causes edema. Here exudates, there transudates, and leukocytes in extravascular space. So here this one will create increased vascular permeability. This one is the hallmark in acute inflammation. Normal endothelial cell we know, this one here create gap formation. Why it will, this one will create gap means it will take this WBC to out. WBC out. This leads to escape to protein rich fluid, that means exudates. Most affected vessels are venules. Fluid and protein comes out. So here fluid as well as protein comes out. It is exudates. That third step, initial stage escape of fluid is due to elevation of hydrostatic pressure. This is transudates in nature. Second one is escape of fluid. This one due to increased vascular permeability of microvasculature. This one is the exudates in nature. That means protein as well as water content. So here five important mechanism is there. So summary of this one, five important mechanism. First one is formation of endothelial gap. Second one is direct endothelial injury. Third one is leukocytes mediated endothelial cell injury. Fourth one is increased transcytosis. Fifth one is leakage from new blood vessels. This one is the mechanism. So first one is two endothelial cell contract. So this one is the endothelial cell. Here contract this contraction. So here first step contract to endothelial cell. This one is the immediate transient response. This one is the immediate reaction. Formation of endothelial gap, most common mechanism for increased permeability. This one occur due to contraction of endothelial cell, subcytoskeleton. Then so here hole will form. How that hole will form? After bacteria entry, it secreted the toxin. The toxin causes necrosis in that blood vessels, blood valves. So it make a hole here. This one is the endothelial cells. So here it make a hole. Hole junction only. So here it make hole in junction only. Then a direct endothelial injury, then immediate sustained, that one is the immediate process. This one is the prolonged also. This one responsible is rapid but long lived. This one occur due to direct injury caused by necrosis and detachment of endothelial cell by toxin infection or burn. Here, all level of microcirculation are affected, including venules, capillaries, and arterioles. Then, third one is leukocytes. Third steps is the leukocytes mediated endothelial cell injury. This one is the delayed prolonged response. Leukocytes are activated and causes endothelial cell injury. So this one affected junction as well as subjunction also. Hole occur junction and subjunction also. This one affect venules mostly and pulmonary and granular capillaries. Then third steps. First step that two endothelial cell contraction. So formation of endothelial gap. This is the most common mechanism. Second, bacteria outside and causes direct injury and necrosis of that wall of the blood vessels. Third one from inside. So inside here WBC presented inside. So inside this attachment from inside here WBC will causes necrosis of that wall of that the blood vessels, blood valve. So here this WBC will make a hole. Okay, so will causes necrosis of that blood valve. Fourth one is increase transcytosis, that is cell to cell movement. Fourth one is increase transcytosis. So what is the things here? Small vesicles are formed inside this endothelial cell. Inside small vesicles will form. So through this WBC through vesicle will go outside. So fourth one is increased transcytosis, that is cell to cell movement. WBC will move inside endothelial cell through vesicles. So through these vesicles it can move and go out that transcytosis. Then fifth one is Wherever inflammation occur, new blood vessels occur, that is angiogenesis. Fourth one is angiogenesis. Whenever inflammation occur, new blood vessels will occur, that process name is called as angiogenesis. In this angiogenesis, which is caused by VEGF, vascular endothelial growth factors. So this one is the cell to cell travel. That process name is called as transcytosis. Then fifth one is here, new blood vessels formation. So overall major site of leakage is venules. So first one is immediate and transient. Second one is immediate and prolonged. Third one is delayed and prolonged. Fourth one is that vesicle formation, vesiculo organelle, cell to cells travel. That process name is called as transcytosis. Fifth process, new blood vessels formation. New blood vessels formation. A new blood vessels formation name is called as angiogenesis. Then fifth one is slowing or stasis. Increased contraction of red cell, raised blood viscosity. Here fluid also, in these steps fluid also come out, protein also come out, only that cells only is presented. So that process name is called as stasis. So acute inflammation, vasoconstriction, that one is the transient. Vasodilation, persistent. Ruber, calor formation. Third one is increase hydrostatic pressure. That because of that one causes edema. Fourth one, increased vascular permeability. That one is the hallmark steps. Okay, there also edema, but fourth step, protein and water molecules also move out. Then only RBC only is presented, so that name is called as stasis.